My God, what a journey. I apologise in advance. This video will probably be a little bit disjointed. I will be writing about this on my blog, on the website, slippingribsyndrome.org. I'm a lot better at writing than I am at speaking, and I'm certainly not a YouTuber. But you know, I wanted to to talk about this as well as write it, really. So yesterday I had my dynamic ultrasound in London, which, you know, I was nervous about, but I was also really looking forward to. Getting there was quite painful. You know, I only had to walk about 100 meters from the train to the taxi rank, but it was tough. It was a really difficult day, especially sort of emotionally, because I think I kind of felt like I would go there, get the diagnosis, and then, you know, surgery would be recommended. I think it's important for me to point out that most people get a referral to the surgeon, and then the surgeon refers or recommends, in the UK, going to have a dynamic ultrasound. I've done it in reverse, so I went to get the dynamic ultrasound to have evidence to give to my GP before they refer me, because I know that my GP doesn't know what slipping rib syndrome is or that it exists, so I need to have solid evidence of this is what I've got and this is what I need. So I went there, and I think I've been thinking about this so much for so long because it means so much to me that I kind of created a script in my head of how it would go, and because it sort of, when I think about it, because it deviated from that script, it threw me off emotionally. I feel a little bit better about it today. In short, I have a diagnosis, which is good. That's what I went for, and we can move forward with that. But I think it's a little bit more complicated than we originally thought, or that I originally thought. I will get the report in the next few days, so I will be posting another video with more information from that. It's kind of a blur because there was so much going on, and I was so sort of invested in the ultrasound. From what I remember, we did the ultrasound, we looked at the ribs, and the doctor seemed to just focus on one side, the worst side. I took 2.5 sheets of paper of, you know, my symptoms and my theory of what was happening, and he seemed really pleased with that, but I didn't get a chance to use it. There was a lot of stuff that was not said that I think would have been helpful, but in hindsight I think that it is the surgeon that needs to see and hear that. I got what I went for. I needed evidence to get a referral, and I've got that. At first we didn't get the ribs slipping, and there was a point I was doing like sit-ups, but I can't sit up very far. I did have abdominal surgery in 2016 that had severe complications, and I have massive scar tissue there. So, you know, the Dr. Abbasi agreed with me that the muscles are not as strong as they should be. So I was able to sit up a little bit, but not very much. And we didn't get the ribs slipping, and there was a point when he said to me, you know, I don't think that you have slipping rib syndrome. And I just froze, you know, it was like time stood still. And I said to him, you know, look, if I do a crunch, if I sit up and I crunch forward, you will get the slipping rib. And I'm so glad that I said that, because I used to be a really sort of meek person who would, the amount of times I've left a doctor's office knowing that there was something wrong, and I've just accepted, you know, what they've said. But I was strong enough to advocate for myself, and I did it. And we got the footage several times of the rib 10 slipping under 9 really, really clearly. And Dr. Abbasi seemed to be as happy as I was that we got that footage. What I wasn't happy about, that threw me, was I didn't get across how much this is affecting me. Dr. Abbasi said that he's going to recommend nerve blocks, between two lots of nerve blocks. I'll tell you more about that in the next video because I need the report. And abdominal strengthening, which kind of threw me because most of the people that I know and have spoken to have just had surgery. But what I need to remember is, they see the surgeon first, or they don't see, a lot of people in the US in particular, they don't have dynamic ultrasound, they rely on physical examination. I have to have faith that my surgeon will listen to me and will see the other stuff that's going on. For example, I've got a deformity on the left side that is, you can't see it, but you can feel it, and it is absolutely really, really obvious. We booked and paid for a sort of both sides, but the doctor still only focused on one side, which kind of, that got to me a little bit. I think if he had sort of looked at the other side, he would have seen that and got it really clearly. One thing that I do remember is that he said that there was an abnormality between two of my ribs that he's never seen before, and he didn't know what it was. So I guess, we won't know until I'm opened up, if I'm opened up. And also he said something about the bowel going through, herniating through a space in the ribs. But again, everything is kind of just a blur because there was so much that was said and there was so much going on. So I'll know more about that when I have the report. From what I've read about intercostal nerve blocks, they don't work for everybody. The other thing is, I miscounted my ribs, and I thought that rib 11 was rib 10. So I pointed out that how much that is moving. Dr. Abbasi did say that there was hypermobility. It moves a lot. It really does. Probably a couple of inches. So now that I think about it, I think as well as the slip ribs, I have rib tip syndrome, which makes sense because the pain when I walk is my flank area, and it's localized to the tips of ribs 11 and 12. So I briefly looked at what could be done surgically to improve that, and it looks like resection. So, I'm thinking that maybe I'll have to have 2 surgeries, or like 2 in 1, and have resection on 11 and 12, and have 10 sutured to 9, etc. Everybody that I know, pretty much, and it's a lot of people, I've spoken to people all over the world. Everybody I know has had surgery for this, apart from one person. And there's very few people that seem to be as impacted mobility-wise as I am. I really want to go back to work. I want to, financially this is impacting me massively, and mentally. I've already been off for 2 months. I just want to have a normal life. I want to be able to do everything that I could before. I was very, very physical. So I feel like surgery is the only option for me to have a normal life. I'm willing to do strengthening exercises. It hurts. I tried it this morning. I tried some sit-ups, and it really aggravated me. I'm willing to try intercostal nerve blocks, but I really don't think that that's going to solve the problem. I hope that I'm wrong, but I'm gonna push for the surgery, and I understand why somebody would say, okay, let's try other things first, because surgery is painful and it's invasive and it takes a long time to recover. And I know that because the last time I had surgery, which was abdominal, it was unrelated, it took me about 3 months to recover, and it was really hard. But this is impacting my life and my quality of life so much that I'm willing to go through that level of pain and discomfort, and you know, I know it'll be hard, but that's what I want. It's the only way I can see me having a normal life again, and I don't expect to be 100% ever again. You know, I think that would be unrealistic, but even, you know, there's people I've spoken to that have gotten to 60% or 80%, and I could live with that, you know? But what I can't live with is that feeling of being dismissed. And what I've got to remember is, you know, I went there and I got what I needed. I feel like in that script in my head it was, okay, yeah, you've got it, surgery. And that's not what's happened. I know that the final decision is rests with the surgeon, and hopefully he will understand, you know, how bad this is, and listen to how much it's affecting me, because, you know, I'm not making this up. Yeah. So I know that this is a long video and it's disjointed, and I'm sat in my dressing gown because I don't feel like I can get dressed yet today because of pain. I suppose I'll leave it there really, and I'll do another video in the next few days when I have my report.